Taylor, and I will be your nurse educator for your medication administration training. The 3 key points that we will be reviewing today are the responsibilities of medication administration, common complications and warning signs, MedPass, and documentation. Responsibilities of medication administration. Before administering, you want to make sure that you are washing your hands. We want to ensure that we are using universal precautions with all clients. This means that you are protecting both yourself and the client from spread of infectious diseases and germs. You'll want to make sure you wash your hands thoroughly, read the order thoroughly, and gather the proper equipment. So you'll need to protect yourself by always hand washing and wearing gloves, as well as using medication cups. Prepare the medication accurately. Universal precautions refers to the handling of all blood and bodily fluids as if it were contaminated with infectious diseases, and should be followed whenever there is a chance that you will be in contact with blood or bodily fluids and or objects that may be contaminated, such as razors and toothbrushes. PPE are our personal protective equipment. This is going to protect you. Wearing your gloves, your mask, your gown, or glasses in the case that they are needed. Hand washing is the most effective way to prevent the spread of germs. You need to wash your hands at the start and finish of work, prior to and following the contact with anyone, after removing your gloves, before and after a med pass, and after touching a toilet or changing someone. The responsibilities of medication administration before administering. Identifying your 6 rights of medication administration. The correct medication, the correct dose, the correct client, the correct route, the correct time, and the correct documentation. Preparing your medication for administration. You're going to check 3 times to ensure accuracy. You want to count the correct amount of pills before measuring and pouring. Check the medication label with the med order. After pouring, check the med label and the order with what was dispensed. And before administering, check the dispensed meds with the times and the orders. If you check 3 times, you reduce the chances of any error. We will start with washing our hands. Never give a medication that you cannot read the label for. Only the pharmacist can relabel the med. Check the expiration date, especially on medications that are just given as needed, also known as PRN medication. Identify the client, explain, and answer questions that the client might have about the medication. Always pour the med into the appropriate container. Stay with the patient to make sure that the medication is swallowed. Observe for any side effects. Immediately sign the MAR, the medication administration record, after administering. If a medication is omitted or missed for any reason, it must be documented. If any errors occur, report it to your supervisor. Observe for any side effects and document in your incident report and e-fax to your supervisor. You and your supervisor will be responsible for notifying the doctor, nurse, family, or pharmacist and follow any new orders. Once you have completed giving the medication, you want to make sure that you check each section for remaining orders, treatments, or non-prescription standing orders. Look all through the MAR prior to leaving the medication area to ensure all meds have been given and all spaces initialed. Ensure that the name and corresponding initials are written on each med sheet. Report any treatments, documentation, or administration errors. Documentation. Documentation must be legible in blue or black ink, no other color ink. Medication administration record, better known as the MAR, is a legal document. Your initials and signature indicate your responsibility for what was done. For errors, mark through with 1 line your initials and write ERR for error above the entry. Indiana state law requires us to keep records for 7 years. If a medication and the days of administration have been highlighted, that means that medication or order has been discontinued and should not be administered. The discontinued meds should be destroyed with you and a supervisor. Meds should be flushed for proper disposal. If the med is a controlled substance, it must be taken to the office to be destroyed. Initial and sign the MAR maintained in the home monthly. This applies to goals as well. Record any observation about the client's reaction to the medication. If it is not charted, record it or document it. If it is not legible, it was not done and it did not happen. Medication administration record. Open your life book to your MAR. Look through the MAR to review what medication you will be giving. Gather all of your supplies, your gloves, your pill cutter, your crusher, your water, etc. Wash your hands. Be sure to utilize proper hand hygiene. Have your consumer or client also wash their hands. Get out the toolbox, which contains all of your client's oral medication. Also, any bottles, boxes, or containers of medication that you may need. Start at the first medication on the MAR and go through the MAR, comparing it to the inside of your weekly pill pack to determine if you have all the medication together that you are going to need. Pull all the medication and put them in the cup for MedPass off of the weekly pill pack that are indicated for the medication pass you will be preparing to complete. Compare your MAR to the medication's cup listed on the backside, ensuring that all the pills are in the cup that you will need at this time to administer. Once you have completed this second step, open your pill cup. Count the number of pills that you have in the pill cup and then count the number of pills that your MAR says that you're supposed to have. These are your 3 steps to checking to make sure that you're administering the proper medication. This is very important. Give the pill cup to your consumer or client and watch them take the medication that you gave them. After you are sure that they swallowed all of their medication, go back through the MAR, sign off on the daily boxes that coincide with the medication that you just administered. At this time, you will begin watching for any side effects. If you have a controlled substance, you must ensure that you have signed it out. Charting on controlled substances is done per the DEA guidelines. You have no option but to do this correctly. Controlled substances. Controlled substances are drugs that are rated using a system of schedules based on the potential of abuse and addiction. All controlled substances must be double locked. All controlled substances must be counted every shift change. Make sure that you have a witness when counting meds. You will be using your buddy system. Controlled substance log. Due to recent changes in federal laws, not all controlled substances will be in bubble packs. You may have patches or bottles or pills that need to be counted at shift change. When you come on shift and begin the buddy checklist, one of the things you do is count your narcotics or better known as controlled substances. You open the controlled substance log and you should find that the top left side of the page has a copy of the label for the prescription. The right upper side says who delivered it to the house, who checked it in, and the number of the pills that were received. As you go down the column to the last entry, you will find the correct count of that medication. You check the card to ensure that you have the correct number of pills remaining. You then write the date, the time it is that you are counting, the number of pills you gave, and sign your name. You may not add to a current controlled substance log. If you get a new bottle and the consumer still has 5 pills left in the previous bottle, you begin a new sheet for that new bottle. Yes, if you have 2 bottles to count, you will need 2 sheets. 1 prescription fill per log. Same with patches. Whatever the narcotic medication is, you cannot add to a current log. That bottle didn't just magically sprout 100 pills, so it will need a new log. When you administer a controlled substance, you pop it out of the card if it is in a bubble pack. Put your initials, date, and time on the card beside the bubble you popped out of. You then sign it out of the controlled substance log. Place the date, the time, and the number of pills remaining, and sign your name. There is a proper form that you will be using in all of your client homes. Please make sure you use the form that is provided. If you use the last form, or if they are low, please be sure to notify your supervisor or make copies. Buddy checklist. At each shift change, there are 3 things related to medications that you must do to complete the buddy checklist. They are to be completed prior to leaving your shift and at the beginning of your shift. This will be done by a staff independently in only 2 scenarios. When leaving in the morning and dropping the consumer off at a workshop or a day program, or when coming onto the shift in the afternoon at a home where the consumer is already at the day program or workshop and they are the one picking them up. Check all the medication that are not in the daily dose packs to see if anything needs to be reordered. This includes PRNs or as needed medication, liquids, powders, ointments, creams, and controlled substances. If the supply is equal to 5 days worth of medication or within 5 days of the medication expiring, you must contact your supervisor and inform them of the need for a refill. You must check the MAR for holes. Holes are squares on the MAR where staff forgot to initial taking responsibility for administering medication on that date or time. If the person you are replacing forgot to initial the MAR but administered the medication, at this point is when they have their last opportunity to initial the MAR before the hole is considered a med error. That person should be sitting beside you when you find the hole. The med error, if it is not able to be initialed, then you will need to complete an incident report. Count the controlled substances in the home per the controlled substance procedure. All of your medication need to be stored in a secure lockbox. Controlled substances do need to be double locked so they can be locked in your lockbox, and then this can be in a secure file cabinet that is also locked. As a reminder, be sure that you store all oral medications together. All lotions, creams, powders should be separate from your oral meds. You can store your controlled substances and regular meds together. However, you must keep all meds double locked in your lockbox if you can keep controlled substances with other medication. Refrigerated meds must be locked in the fridge. Pay close attention to expiration dates on these refrigerated medications as they can be missed very easily. Out of the house medication. An out of the house medication is one that is to be administered while the individual is away from their client services. For example, if the individual goes home with the family. When an individual is out in the community with their client services representative, then this does not apply. When your staff is notified that an individual will be away from their client services, he or she will prepare the medication to be taken with the individual. The staff will prepare the medication by reviewing the medication administrative record, MAR, for the time frame that the individual will be out of the home. The medication container will be given to the person responsible for administering the medication while the individual is away from their services. The staff will document on the back of the MAR as follows: the medication to be sent with the individual, the time frame the individual is expected to be away from their services, and who will be administering the medication. At the time that the medication are to be administered, the staff will document OH on the correct date, and be sure to complete the comment on the back of your MAR. This indicates that the individual was not at the program site at the time that the medication was to be administered. When out-of-the-house medications are not taken while away from their services, an incident report will need to be completed by the staff when the individual returns home and to be submitted to your supervisor within 4 hours of the incident. Health-related visit. During a health-related visit, you need to bring a form and do the following. When staff take the consumer to the doctor's office, they are to take with them the health-related visit form with the following information filled out: name, date of treatment, allergies, current medication, current diagnosis, reason for the visit, printed name of the professional, and staff signature. The staff is to ask the doctor to fill out the remaining items and explain any medication changes. The remaining items are medication changes, recommendations, new diagnosis, physician-reviewed medication and treatment documentation, return visit, and physician's signature. Be sure to make sure you get that return visit and your physician's signature. After the appointment is over, the staff are to e-fax the health-related visit form to the office along with any scripts. The supervisor reviews the forms and starts to implement any recommendations from the doctor. If a nurse is required, the nurse reviews the health-related visit form and follow-ups with the supervisor and with the staff to make sure that all recommendations are being followed. Common conditions. We will be reviewing a couple common conditions that clients might experience. Choking and constipation are the leading cause of death in client services. Constipation is caused by infrequent bowel movement or having difficulty passing a bowel movement. You might notice your client having a swollen abdomen or abdominal pain, general pain, vomiting, or reporting that they haven't had a bowel movement. This can also be as a result of certain medication that your client might be taking. If you notice that it is a medication on the side effect that might be constipation, then you will need to be on alert for this. Up next, we will review aspiration. Aspiration is the passage of food or liquid through vocal cords. It gives you the sensation that food is going down the wrong way. It can be a serious consequence of dysphagia. Signs and symptoms are choking, coughing, gagging while eating, drooling, food falling out of the mouth while eating, smells of vomit or food after a meal, elevated body temperature, abnormal lung sounds, rapid or labored breathing, wet aspirations after mealtime, unusual amount of time taking eating, and meal refusals. Choking occurs when a foreign body becomes lodged in the throat or windpipe, blocking the flow of air. In adults, a piece of food is often the culprit. Young children often swallow small objects. Because choking cuts off the airway and oxygen to the brain, first aid and CPR should be administered right away. Call 911 if necessary.